guy had a metal piece pierced in his leg. I'm Dr. Rupal Patel. Originally I'm from India. I was trained medical school in India, then came to United States, cleared my boards to practice here. I did some training in hip and knee replacement, one in Methodist Hospital, Houston, Texas, and then I came to VCU where I did another year long of special training in revision hip and knee replacements. My orthopedic residency training was partly in Florida and partly in India as well. Currently I practice, I have been in practice since 2012, but currently I practice mainly, my main affiliation is with VCU Health, and I do surgeries in HCA hospitals like John Randolph, Chippenham Hospital. My main area of expertise is hip and knee, including replacement as well as knee fractures and hip fractures. I do all kind of trauma when I take the trauma call. Coming from family of surgeons, my father is oral surgeon. My uncle who lived with the same and joint family, he is a cancer surgeon for head and neck. And my cousin, she went into gynecology surgery. So while growing, I knew that I wanted to be a surgeon. When went into the medical school, rotating different specialties, I found orthopedic was very interesting, and actually that went coincides with my hobbies. From even get-go, my father was good with tools, and we had a nice garage filled of tools. We built some furnitures in the garage. So even though he was dentist, he liked those tools. I got that hobby in me, and that's what got me into the orthopedic. I liked to use the video game. It was like a playing video game, doing arthroscopic surgery, looking into the screen. All these things got me into orthopedic, and now it's even more interesting when more technologies are coming, including robotic surgeries and also navigation in doing hip and knee replacement. That's really fascinating. Recently I was on call actually in this hospital. A 10-year-old kid was brought by parents, and he said, I was just mad and I jumped from second floor window. He broke his wrist as well as elbow, and I had to fix both at the same time. He did well, but yeah, they are always associated with some kind of story. The other patient, I'm just going recent experiences. There was a younger guy, motorized skateboard. He fell and had an open tibia and fibula fracture. So I operated that. Next morning, he was still hurting in the stomach. Interestingly, the CT scan was negative at the time of ER, and then next morning we did another CT scan and found the hole in the intestine from trauma. So he had to go that another surgery. Small simple things like just skateboarding can lead you to 2 surgeries within 24 hours. With my partner who was taking calls in another HCA hospital, Chippenham, MVA. The guy had a metal piece pierced in his leg. Looking more into it, we found that the brake pedal actually broke and sharp piece went into this leg, crossing from outside in. So we had to just put him into sleep directly before even we could do anything. We had literally in the instruments where we had to cut one side and then pull it out, because other side there was a pedal hanging, brake pedal, so we had to break it. Actually, we learned some things, that some of the appointments can be done televisit because of COVID, and at this point I'm doing at least 4 or 5 patients as televisit. That saves their tremendous time of driving to and fro from the clinic. waiting into the waiting room. Rather, we call them, they pick up the phone. Sometimes we do Zoom video conference, do the examination. It saves their almost 2 hours, and they could do their own work at home while they have their visit. So some of the patients we learned, and that's what we are trying to incorporate in our practice. And I think most of the other practices as well, they learned about these things. So there is some plus about that COVID pandemic. Alright, the hip fracture is very common fractures we encounter. Actually, the recent data from the latest epidemiology was in 2018, where they counted there were about 360,000 hip fractures every year. That makes it 1,000 hip fracture every day, which is a huge number for hip fracture. In even our practice, we fix at least one hip fracture every day by one of our partners in this hospital. So it is very common fracture. For the EMS, I will say when they get called for the older patient who just fell from ground level, if they see the leg is shortened and externally rotated, and if they are hurting right around the hip, there is very high suspicion that there will be a hip fracture. According to several studies, it has been shown that if you operate the hip fracture within 24 hours of arrival to the hospital, or even 24 hours from the fracture itself or fall, it gives you huge amount of benefit in getting better outcome. If we operate within 24 hours, they are up out of bed right away. That prevents complications of bedridden patients. If they at certain age, after age 60, 65, if you stay in bed for longer time, basically your muscles will get wasted. Sometimes you get pneumonia, blood clot. If they stay longer, there can be even bed sores. So it's better we operate them earliest possible and then get them out for physical therapy, get out of bed. Actually, HCA is one of the group who is promoting that, and we have a hip alert. As soon as the patient comes to the ER, they will generate the hip alert. So everyone, the surgeon, the OR team, admin, they will know that we have to try to fix this fracture within 24 hours, and we try to give best outcome to the patient. John Randolph Hospital has an orthopedic coverage where we can do any emergency surgeries 24/7. They have some dedicated rooms where they will open extra rooms if some other rooms are occupied for getting other surgeries done. But if we have to do something, we can open another room. Anesthesia team will be available to do emergency surgeries. As far as orthopedic trauma, our team, mainly VCU Health, is helping with covering the HCA hospitals, including John Randolph, but we can manage most of the orthopedic fractures in this hospital. One situation where I would warn EMS people is the chance of compartment syndrome. For the long bone fracture where the skin is intact, there will be bleeding inside the leg or arm, and that will cause really compression of the compartment, which can compress the blood supply as well as nerves. The signs are that the arm become colder, you don't feel the pulse, there is tight muscles in that particular area. Then you want to immobilize the patient as quick as possible and get to the hospital so it can be treated appropriately. Other thing I will say, if you see any fracture or injury to the leg or arm, first thing you want to check, you want to take out jewelries because they can be constrictive bands. Same thing, before you splint it, you take out some clothes so you are not putting any constrictive bandage on that, which will further damage the blood supply.